I'm Dr. Sharda Jain. Today I'm going to talk how BRCA 2 can help in breast and ovarian cancer. Breast cancer is #1 cancer among Indian women. It is estimated that this year, India could have as many as 1.8 million cases of breast cancer. In general population, 1 in 8 is going to develop breast cancer, 12%. And in case if it is BRCA1 is positive, then in that particular case, the risk increases from 12% to 50 to 80%. If BRCA2 is positive, the incidence of breast cancer rises to 40 to 70%. This is the importance. So if we find cancer in the first degree relative, this investigation can help them a lot to take a timely decision and save their quality life. Another fact, जिसको एक बार ब्रेस्ट कैंसर हो जाता है, उनको रिकरेंस हो जाता है 5 years के अंदर, and the incidence varies from 3.5 to 11%. दूसरी ब्रेस्ट में आ जाता है. अगर ये BRCA1 is positive, the incidence rises to 27 to 30%, and if BRCA2 is positive, the incidence rises to almost 40 to 50% at 20 years. Very, very important. As far as the ovarian malignancies are concerned, the incidence in general population is of developing devastating fatal ovarian cancer is 1 to 2%. And in case BRCA1 is positive, the incidence rises up to 40%. And in case BRCA2 is positive, the incidence rises to 18 to 20%. So all clinicians, all gynecologists should require a detailed family history, the personal history in every case of breast, ovarian, colon, and endometrial cancer, and offer genetic testing in appropriate families and appropriate individuals. Genetic testing offers a possibility of risk evaluation, and if positive, it increases the chances of developing cancers many fold. So the timely management is applicable even in patients who do not have any symptoms. Many patients are quite aware of possibility of familial cancer and requesting for testing, but misinformation is widespread. So the correct information must reach them. It is an autosomal dominant inheritance, very clearly made from this abnormal BRCA mutation. We find that nearly 50% patients will manifest it. What are the potential benefits? The clinical intervention may improve outcome. Family members at risk can be identified, positive health behavior can be reinforced, and reduction of uncertainty of screening is not there. Once they have completed their family, once they make up their mind, they can definitely go ahead for preventive treatment. This is another fact कि अगर मदर को कैंसर हुआ है, तो अगर BRCA1 और BRCA2 म्यूटेशन पॉजिटिव है, तो उनकी डॉटर्स को 8 साल पहले हो जाएगा. So the people who are positive, they manifest 7-8 years earlier than their relatives. Now, what is the role of risk reduction mastectomy? Bilateral risk reduction mastectomy decreases the risk of developed cancer by at least 90% in moderate to high risk women with BRCA1 and BRCA2 positive. Option of risk reduction mastectomy to be offered on of surgery and the surgical breast reconstructive options. So they can decrease the incidence for good 90%. Now coming about the ovarian cancer. Just now I told you that ovarian cancer in the general population is 1 to 2%. And if it is BRCA1 is positive, the ovarian cancer chances increases to almost 40 to 45%. And if it is 2 is positive, then the chance of ovarian cancer development increases to almost 20%. If the mutation of both genes increases, lifetime risk of women to develop ovarian cancer up to 75%. So BRCA testing in all women should be done with serous epithelial ovarian cancer, and 20 to 25% women positive even without family history. This is very, very important. They respond very well to chemotherapy, and FDA approves BRCA positive ovarian cancers therapy where it can be effective. Now what need to be done? Bilateral risk reducing salpingo oophorectomy, RRSO. Once person has completed childbearing or earlier than 40 years if it is done, many studies are available which show there is an 80% reduction in the risk of ovarian and fallopian tube cancer following RRSO. RRSO also reduces the risk of breast cancer in carriers or BRCA mutation by 50%. So all gynecologists should know about BRCA1, BRCA testing, both in breast and in ovarian cancers. The cost at this particular time varies from the complete package, something like 22 to 23,000 combo screening. And I think this particular information will help you a lot. Thank you very much for listening me. My only request is that all people who are general practitioners, lady doctors, all gynecologists should know about breast issues, how to deal with these patients. Thank you very much.